Center for Medicare and Medicaid Services is part of the federal government that oversees the Medicare and Medicaid programs. Abuse is defined in the CMS rules as provider practice that are inconsistent with the sound physical, business, or medical practices that result in an unnecessary cost to the Medicare and Medicaid program and reimbursements for services that are not medically necessary and that fail to meet professionally recognized standards of the healthcare. Abuse includes excessive or improper use of resource, intentional distractions, diversion, manipulations, misapplication, misuse of resources, and extravagant and excessive use as to abuse one's positions of authority. It also includes beneficiary practices that result in unnecessary costs to the Medicare and Medicaid programs. A provider can abuse Medicare Medicaid program even if there is no intent to deceive. Fraud. Fraud is different and involves intent. Okay, abuse, maybe no intent. Fraud is intent. Waste is a practice that results in unnecessary costs. Provider, beneficiaries, corporate officials, and others can commit healthcare fraud. The rules governing Medicaid defines fraud as an intentional deception or misrepresentation made by a person with the knowledge that the deception could result in some authorized benefits to himself or some other person. It sounds like abuse, but it's actually fraud. It includes any act that constitutes fraud under applicable federal or state laws. Federal False Claim Act (FFCA) protects the federal government from being overcharged on sold substandard goods or services. The FFCA imposes civil liability on any person who knowingly submits or causes the submission of a false, fraudulent claim to the federal government. The term knowing and knowingly mean a person has actual knowledge of the information or the act in deliberate ignorance and or reckless disregard of the truth or falsify of the information related to the claim. No proof or specified intent to defraud is required to violate the civil FFCA. There is also criminal FFCA statute by which individuals and entities that submit false claims may face fines, imprisonment, or both. Fraud, waste, abuse in the Medicaid program may occur in many different ways, including medical identity theft, billing or unnecessary services or items, billing for services or items not rendered, upcoding, bundling, billing for non-covered services or items, kickbacks, and beneficiary fraud. Everyone has the right and responsibility to protect possible fraud, waste, abuse. Whistleblower protection provides you with the right to report suspected fraud, waste, abuse without retaliation. Please report any concern to the Chief Compliance Officer. This number providers plays an important role in preserving the solvency of the Medicaid program, protecting beneficiaries from harm, and preventing fraud, waste, and abuse. It's part of the federal government that oversees, yes, Medicare and Medicaid program, yes. Fraud. Fraud is kind of is intentional. And intentional deception and misrepresentation made by a person with the knowledge that the deception could result in some authorized benefit to himself or other person. Yes. If I identified or I am made aware of potential misconduct or suspect fraud, waste, abuse situation, I should keep the information to myself, not tell anyone. No, you should whistleblow. Whistleblower protection provides you with the right to report suspected fraud, waste, abuse, but only with the chance of retaliation. No retaliation. And the followings are the example of the fraud, waste, abuse, medical identified theft, billing for unnecessary services, items billings for services, items not rendered, upcoding, unbundling, billings for not covered services, or items kickbacks, beneficiary fraud. Yes.